Our driver's rehabilitation program it lasts about 2.5 hours. The first part is a clinical assessment of visual, physical, cognitive abilities. We look at range of motion, strength, coordination, things that are needed to drive. The second part is a 1-hour on-road assessment. It's with a certified driving rehab specialist who's also an occupational therapist like myself. He takes them out in a car that is similar to a driver's ed car with a second brake, and they perform what we call more open-ended driving to really look at judgment and safety skills when they're navigating their self to familiar things like Schnucks or Walgreens, where they're picking up their medicines or getting groceries. Our main diagnosis are those who have had a stroke or a major medical setback where the physician's not sure it's the right time to regain independence with driving. Many times the physician will say, I'd like you to hold off driving at this time, and we'll look at it a little later in your recovery. But again, it's not sure when that time is to restart driving. So that's where our program will come in and let the individual come to us. We do the clinical on-road assessment and really take a look at where they're at in the rehabilitation part of the process and determine if they're ready to drive or maybe if they need a little more therapy. In occupational therapy, in our clinic, we focus a lot on visual skills, dual task, cognitive abilities that are needed. Divided attention is a high-level task that we need to be able to do to drive. And so many times it's not the physical limitations following a stroke that limit an individual from driving, it's more of those cognitive and visual skills. And so our clinic specializes in that area. Judy is one of our patients that came to therapy probably for at least 6 months, and she really focused on arm recovery. She had some visual changes that required a lot of therapy for that. And we focused a lot on how her processing speed was and her safety and awareness. And at a certain point, we felt that Judy was ready to try to go back on the road, and she did wonderfully. She needed a few adaptations because she couldn't use her one arm as well while she was driving. We recommended a spinner knob and a few modifications as far as where she drove and what types of driving that she did do, but she was able to regain her independence with that. Driving is one of those skills that equate independence in many people's view. Sort of like walking. If you ask a patient in therapy, what are your goals, they'll say walking, and the next step is driving. So being able to drive yourself, even if it's just to get medicines and groceries, is a big level of independence for many. So other diagnoses that are appropriate for driver's rehabilitation can be anyone who's had any type of medical setback. It could be someone who's had a hip replacement or hip surgery and their right leg is now weak and they're not sure that they should be driving because the transitions from gas to brake are difficult. Many times we see those with neuropathy in their feet, and now their foot's sliding off the brake pedal at times. So they may need to transition to hand controls. We do evaluations, training with those who need hand controls for diagnoses such as multiple sclerosis or even lower extremity weakness from failed back surgeries or spinal cord injury. So we cover a lot of different diagnoses. Our goal is really just to get people back driving independently. But there are many adaptations for driving. Like I mentioned, the spinner knobs, there are left foot accelerators, there are so many different types of hand controls that allow someone who has very limited movement of the arm and their head to still drive from a wheelchair inside a van. There's a very high level technology that we can evaluate for and train an individual so they can regain their driving skills. Another part of our driver's assessment program is to assess those who it may be time for them to retire from driving. Commonly that's individuals who've had maybe some difficulties with their cognition, memory skills, commonly dementia, and family members and physicians have concerns with their safety with driving. It's a very hard and difficult topic to many times bring up and discuss with family members. So our program offers the same clinical and on-road assessment that we do with other diagnoses, but it offers objective information on how they're doing with their driving and is it the right time to retire from driving. So when we complete our assessment, we meet back with the patient and their family members, and we discuss the results of the assessment and we make our recommendations. Our recommendations are not final. The physician is responsible for making that determination on whether they can continue to drive or whether they should retire from driving. I just kind of feel that driving is one of the highest functional things that an individual can regain after they've had a major medical setback. They work so hard to get back to walking and cooking for themselves and getting themselves dressed, and the next step for independence is driving. So I just think it fits hand in hand with all the other services that we're offering. Driving is such a big opportunity for community access and socialization. I just think that it goes hand in hand with our OT department focusing heavily on the neuro population. It's a need that's definitely out there, and we fill it.